Heart disease is one of the leading causes of death worldwide, and one of the biggest challenges is that many heart problems develop silently. A person may feel completely fine while dangerous changes are already taking place inside the heart and blood vessels. What if these problems could be detected before serious symptoms appear? This is where artificial intelligence, or AI, is beginning to transform cardiovascular healthcare. So how does AI actually detect heart disease? Artificial intelligence is a technology that allows computers to learn patterns from large amounts of data. In healthcare, AI systems are trained using thousands or even millions of medical records, heart scans, ECG readings, blood test results, and patient histories. By studying these patterns, AI can help identify signs of heart disease much earlier and more accurately. One of the most common tools used in heart care is the electrocardiogram, or ECG. An ECG records the electrical activity of the heart. Traditionally, doctors examine these recordings to look for irregular rhythms or signs of heart damage. Today, AI can analyze ECG data within seconds and detect subtle abnormalities that may be difficult to notice with the human eye alone. AI is also being used to examine medical images such as echocardiograms, CT scans, and MRI scans. These images provide detailed views of the heart's structure and function. AI systems can measure heart size, evaluate pumping efficiency, identify damaged tissue, and detect narrowing of blood vessels. This helps doctors diagnose conditions more quickly and accurately. Another important use of AI is risk prediction. By analyzing factors such as age, blood pressure, cholesterol levels, blood sugar, family history, and lifestyle habits, AI can estimate a person's future risk of developing heart disease. This allows doctors to recommend preventive measures before major problems occur. Wearable technology has also expanded the role of AI. Devices such as smartwatches can continuously monitor heart rate and heart rhythm throughout the day. AI algorithms study this information and can detect irregular patterns, such as atrial fibrillation, a common heart rhythm disorder that increases the risk of stroke. In some cases, these devices can alert users to seek medical attention before symptoms become severe. The use of AI in cardiology has grown rapidly as advances in computing power and medical data have made it possible to analyze information on a scale that was previously impossible. However, AI does not replace doctors. Instead, it acts as a powerful assistant. Doctors still make the final decisions, but AI helps them work faster, identify risks earlier, and improve accuracy. Today, researchers are also developing AI systems that can monitor patients remotely, predict worsening heart conditions, and personalize treatment plans based on an individual's health profile. These innovations are helping shift healthcare from treating disease after it occurs to preventing disease before it becomes serious. Artificial intelligence is changing how heart disease is detected and managed. By analyzing heart rhythms, medical images, patient records, and real-time health data, AI is helping doctors find problems earlier and make better decisions. As technology continues to advance, it may play an even bigger role in protecting heart health and saving lives. But before we move to the respiratory system, we first need to understand the organs that make breathing possible. In our next video, we'll explore how the lungs work.